Ever wondered why fibromyalgia is so misunderstood? Well, it's because we don't understand it. We only have theories about what causes it, and diagnosis is based on best guesses and a process of elimination. That doesn't take away the pain and anxiety that comes with it. And I've never seen a condition that causes so much skepticism and so much grief at the same time. There's a famous metaphor used to describe what a day in the life is like for someone living with chronic illness called the spoon theory.
So how does it feel being sick? I feel like I haven't seen you in months and I want to know why.
Every morning when I wake up, I question how I feel, if I'm in pain or if I'm too exhausted to even sit up. This morning I gave myself 20 spoons, and so far I've already gotten up, brushed my teeth, showered, and gotten dressed. And then I made breakfast for everyone. I ate, and then I cleaned up, and then I drove to work. Then I worked a full day. And then I drove home. I made dinner, unloaded the dishwasher, and then cleaned up. And now I only have one spoon left, and I still have to help the kids with their homework. I still have to prepare myself for the week. I still have to call my friends back. I still have to get ready for bed. I still have to brush my teeth. So which one of those do I use this spoon for? Do I borrow spoons from tomorrow's reserves? Because if I do, then I'll have less energy to do all the things I need to do tomorrow.
Fibromyalgia is a chronic condition that was initially identified around 1904 and ranks as the second most prevalent rheumatic disease after osteoarthritis. It's characterized by widespread pain throughout the body, along with a heightened sensitivity to pressure and touch. People with this condition often experience fatigue, sleep disturbances, memory problems, and mood issues like depression and anxiety. Now, you may be saying, well, this sounds a lot like chronic fatigue, and you'd be right. However, there's one distinguishing factor that sets it apart, which is the presence of trigger points or specific areas on the body that are unusually sensitive to pressure. These 18 points are one of the more specific tools used in diagnosing fibromyalgia, although they're not the sole criteria for determining it. So when these points are activated, a hallmark sign is allodynia, or an unusually heightened pain response to direct pressure in these areas. People often describe it as aching, burning, or throbbing. Combine this with other symptoms like muscle and joint stiffness, numbness and tingling in the arms and legs, heightened sensitivity to light, noise, odors, temperature, digestive issues, face and jaw pain, problems with concentrating and memory, sometimes called fibrofog, and painful menstrual cycles, and we've got a pretty good picture of what this might be. The most prevalent symptoms are the pain, the brain fog, and trouble sleeping, which only serves to intensify the prior two. Now, it's widely believed that people with fibromyalgia have a lower pressure pain threshold, which makes them more sensitive, and this is also known as abnormal pain perception processing. Brain imaging studies actually back this up. Poor sleep and daytime fatigue are two common symptoms of fibromyalgia, and some data suggests that people with this condition experience wakefulness during non-rapid eye movement sleep or non-REM sleep, and they get less deep sleep as a result. Increased wakefulness during non-REM sleep disrupts the normal progression of other sleep stages, and less deep sleep is crucial for rest and restoration. This isn't anything new. I'm not telling you anything that you haven't heard. So all of this translates to difficulty falling asleep, staying asleep, and achieving the healing benefits of sleep. And then this contributes to the persistent fatigue and diminished energy levels that fibro sufferers experience during the day. Sleep and fibromyalgia share a reciprocal relationship. Just as painful symptoms can prevent people from getting enough rest, sleep deprivation can make the widespread feelings of pain worse. It's a vicious cycle. So, what about taking sleep medication? Would taking a sleeping pill help with this and in turn help with the symptoms? In one study, participants with fibromyalgia were given a drug called Belsomra, which is approved for the treatment of insomnia. And they slept longer and experienced less pain the next day compared to those who took a placebo. Now, many people are really against taking anything for sleep because historically it's been linked to abuse over the years. But this is something that really needs to be weighed carefully because sleep plays such an integral role in this condition. I take medication for sleep, and it's made the difference between a functioning me and a drooling me, so I can't speak against it. It is definitely not right for everyone, but for this severe insomniac, it absolutely is. I've also experienced another condition that's intertwined with fibro, which is restless leg syndrome, or RLS, also known as Willis-Ekbom disease. And this is a brain, nerve, and sleep condition all rolled into one package. And it's characterized by a strong urge to move or adjust your legs while experiencing a really, really uncomfortable, it's almost like an electric current like sensation. That's at least how I described it. I felt like I had electricity just continuously shooting through my legs. It was, I've mentioned this in a prior video. It was horrible. This occurs most often when sitting or lying down at night. It's almost like when it's time to relax, your body says,
No, we will be having none of that.
some believe that it's due to the brain focusing differently at night, which brings your attention to these sensations more so than during daytime hours. The main theory is it's related to a part of your brain called the basal ganglia, which relies on dopamine to regulate how our body moves. If this part of the brain isn't getting enough dopamine, it can't regulate movement as efficiently as it should. And this leads to restless legs. Genetics can also play a role, as can iron deficiency. Certain medications like antihistamines, antidepressants, and anti-nausea meds, all of them can also make restless leg symptoms worse, which is kind of ironic when you think about it because many of the drugs that I just mentioned for restless legs are also used to treat the symptoms of fibromyalgia. So walking or stretching can temporarily alleviate the discomfort, but symptoms often recur as soon as your body starts to rest again. It is a cruel and unusual type of torture. There is a consistent overlap between fibromyalgia and restless legs, and since both conditions are associated with sensory abnormalities, some patients will be misdiagnosed with either one or the other. The majority of cases don't get diagnosed at all. Fibromyalgia also tends to run in families, so again, genetic factors are likely to contribute, but little is known for sure about the specific genes involved either. Environmental factors also play a role, and these can include having a disease that already causes pain, like rheumatoid arthritis. Some will develop fibromyalgia after having an infection, especially if symptoms were severe. Physical or emotional trauma or a serious injury can act as catalysts as well. In fact, mental and emotional issues are prevalent. Anxiety and depression are interlocked with fibromyalgia, and because of this, there are many who believe that this is where the root cause of it lies. Now, I am a huge believer in this potential link, but do I think it's solely caused by this? No. For most of fibromyalgia's history, it was believed to be more of a psychosomatic disorder, which basically just attempts to explain away the physical symptoms or a diagnosis, saying that they're created or aggravated by psychological issues like stress and trauma. There are some who even claim that you can teach your brain to stop acting as a willing participant in generating and perpetuating this pain and coach it not to freak out.
Right.
And in the following weeks, I'll be doing a reaction to the channel called Pain for You and the theory of PDP, also known as perceived danger pain. It's very interesting, and I'll be really curious to see what I get in the comments as far as what people think about this. So, I mean, while I feel that there's some truth to these concepts and the role that it may play in conditions like fibro and even chronic fatigue, I think that this is oversimplifying things, which as a healthcare community, we've worked very hard to move away from. Although we don't know exactly what causes it and we still have a lot of work to do, I feel that approaching it from a purely mental standpoint sets us way back in understanding the condition and treating it. So, right now, the current treatment regimens consist of antidepressants, anticonvulsants, muscle relaxants, anti inflammatories, stronger pain meds like opioids, and in recent years, non invasive brain stimulation, also known as transcranial magnetic stimulation and transcranial direct current stimulation. There's even some research using electroconvulsion therapy, which has a controversial view due to its history in the treatment of major depression. But today's version has shown promise in treating chronic pain. So we've come a long way with electroconvulsion therapy. Most people, if you mention this, immediately go to a certain way it was done or certain pictures in their mind. And it does not resemble that anymore. So all of these treatments are normally inadequate at making any meaningful impact when it comes to pain relief. And the meds can have pretty severe side effects. Drugs like quetiapine can help with pain and sleep, but it's more suitable for short-term treatment. Others include sodium oxybate, which is used to treat narcolepsy, but also carries side effects like nausea, vomiting, sleepiness during the day, bedwetting, and tremors. Amitriptyline, which is an antidepressant, can cause dry mouth, blurred vision, and weight gain. And then growth hormone has also been used because 50% of fibromyalgia patients have abnormal levels of this. But potential side effects include insulin resistance, enlarged breast tissue in men, also called gynecomastia, muscle and joint pain, and an increased risk of certain cancers. So I'm a strong proponent of combining treatments. Combine symptomatic treatments like the meds just discussed with meditation or mind-body connection techniques such as biofeedback, mindfulness, movement therapies like Tai Chi, psychotherapies, or relaxation therapies. And for those that don't know, biofeedback is when you're connected to electrical sensors that help you receive information about your body to make subtle changes in its state of relaxation. Mindfulness simply means having awareness of thoughts, feelings, and bodily sensations. And although it sounds pretty straightforward, it is something that requires practice and commitment. All mind body therapies endeavor to make us connect our thoughts, behavior, and feelings to help people cope with their symptoms. When it comes down to managing fibromyalgia, pain is subjective, and all too often people suffering from it are heavily doubted. We've come a long way with improving our recognition and expanding our therapeutic management of it. And in this video, I talk about another treatment that's showing a lot of promise for fibromyalgia, and that's IV ketamine. So click here and watch this next. And in the meantime, stay healthy and lucid. Psychological changes like stress or trauma. Coco, there's nobody there, unless it's the bear. We have a bear that gets into our garbage on a nightly basis, so it probably is the bear. We have nicknamed this bear Takeout. Yeah. Huge black bear. Giant. Giant. And it loves my garbage. There's nobody there, Coco. Nobody there. Okay. Rewind. Drugs like how do I say that? Quetiapine. Okay. What is with the wind lately? I want to know. Anybody who makes it to the end and watches the bloopers, answer this question for me. What is with the wind lately? In all of my years have never experienced weather where every other week it seems like we're having a tropical storm or a hurricane. What's going on? I want to know. Kind of want to know. Enlarged breast. But potential side effects include insulin resistance, enlarged breast tissue. Ever wondered why fibromyalgia? That's a mouthful. Fibromyalgia. Now, I am a strong proponent of component. It's because I know why I said proponent. We have papaya in the refrigerator. And I've been struggling to say papaya. Anyway,